How y'all living, my homies and my homegirls? So, as I have made clear on my channel many times, the best option, the golden option when it comes to treating hair loss is to prevent it from happening in the first place. And the best preventative measure is to use a finasteride and minoxidil combination therapy. For many people, even just using finasteride alone will be enough, but the fact remains that as of today and for the foreseeable future, finasteride and minoxidil will likely remain the best choices for people who are trying to fight hair loss. Anyone who wants to wait around hoping something better comes around is doing so at their own peril. Don't kid yourself, guys. Nothing else is coming anytime soon. Even Breezula, which is the next hot treatment for hair loss, which is likely to be FDA approved, is still likely at least a couple of years away. And even though there are other treatments available on the market that may help with hair loss, like stamoxetine, Fluridil, and alpha-estradiol, none of them are backed by nearly as much research as the two FDA-approved drugs, which are, of course, minoxidil and finasteride. So to use any of them in place of clinically proven treatments is risky, and it is much better to think of them as adjunct treatments to be used along with minoxidil or finasteride. Now, it's been known for a while that the existing pharmaceutical options for treating hair loss are the best strategy for maintaining hair. Some people will get regrowth, some people may even get very good regrowth, but for many of us, just maintaining what we have is the best we can hope for. Doctors will usually tell their patients this when writing prescriptions, and even the drug manufacturers will admit that these drugs are better at maintenance than they are for regrowth, yet for some reason, many people will neglect to begin treatment until they've lost ground, sometimes even substantial ground, which means they'll require a transplant on top of pharmaceuticals to get a semblance of their previous hairline that they lost. So why is it that so many people seem to wait so long before beginning treatment? Well, I suspect a few things are to blame. Number one, people give in to fear-mongering about finasteride, and rather than listen to the science backing the drug that proves it is clinically safe, they fall prey to unsubstantiated claims and anecdotes that are impossible to verify, so thus they avoid getting on treatment until it is too late. Of course, the safety and efficacy of finasteride and minoxidil are very well established. The side effects are extremely rare, they are mild, and will often go away on their own with continued use, and will always go away with discontinuation. The people who claim prolonged side effects from finasteride cannot prove it was the finasteride that caused it, especially since the symptoms they attribute to finasteride, like depression or low libido, are common complaints amongst men in general, and can be due to many factors like lifestyle or just genetics in the case of depression. Bashing finasteride is how these clowns cope with their problems, and they hope to spread their misery to others because, like I always say, misery loves company, and many of them are hoping to also get rich quick by suing Merck and hoping that their sob story will persuade a judge or jury to give them a multi-million-dollar settlement so they'll never have to worry about paying for their World of Warcraft subscription ever again, and they'll be rewarded with a lifetime supply of Mountain Dew, Cheetos, and pizza rolls that they can binge on until they die of a heart attack. Post-finasteride syndrome, we've heard about it a lot, but let me tell you guys, it is not a real condition, and if you want more information on that, I have made two very good and very long videos on the subject, which I'll go ahead and link below. So, what's the second reason people don't get on treatment? Well, it's because they take the blue pill and give in to the lie that bald looks good. Deep down, I think most of them know this is complete bullshit, but it helps them cope by thinking that fighting the good fight to stop hair loss is either too risky or too out of their hands, so they'll replace their old biases about hair loss with new biases, and to further confirm their biases, they'll surround themselves with other slapheads who will tell them what they want to hear, even though most people will not have the aesthetics to pull off the bald look, and even if they do have the aesthetics, they still would have looked better had they kept their hair. Now, I know people will tell me, looks are subjective, and that's true, but what does it matter if the overwhelming majority of people will think you look terrible and make negative assumptions about you because of it? I am sure there are even a handful of people out there who think the Pontiac Aztek is a good looking car, but then again, why does it matter when 99% of people think it looks terrible? Now, I am not saying your life is necessarily over if you go bald. You can still invest in a kick-ass hair system, which these days looks about as good as having a full head of hair, or you can just try to rock the shaved horseshoe look if you want, and who knows, maybe you can still lead a fulfilling life. But the question remains, why even let it get to that point? If you have the option to stop hair loss before it even happens, then why not take that option? Maybe some people are of the mindset that their hair really isn't important to them, and who knows, maybe some of them really believe that rather than just say that to cope. But even if they do feel that way, they do not have the right to tell anybody else to just shave it, bro, and just forget about it. Hair is part of our identity and is what helps frame a handsome face. Now, I know there are outliers out there, and there are some people who do like the bald look, but for most people, being bald just makes you look old, it makes you look sickly looking, kind of like a cancer patient, or it can just make you look like a thug. And growing a beard doesn't really help things either. It just looks cliche and like they're compensating for not being able to grow a hair on their head by growing a beard, but to me it looks like the hair is just growing upside down. It's pretty pitiful looking in my opinion, and it's just super common. I mean, it's like basically everybody who goes bald grows a beard and they all end up just looking the same in my opinion. So these are two common causes of failure to treat hair loss on time. But what is another big factor as to why people hold off on treatment until it is too late? Well, in my opinion, it's because many of them think they're on treatment when they're actually not on treatment. You see, people do not come out of the womb knowing how to fight hair loss. We don't learn about how to fight hair loss when we're receiving our public education, although, maybe we should. Maybe somebody should foot that idea to President Biden about including hair loss classes in K through 12 education. People are typically left to their own devices when it comes to fighting hair loss, and the two clinically proven treatments that work the best are not that heavily marketed anymore, so people will often turn to the internet with where to look, and there will be no shortage of slimy, bottom-feeding, snake oil salesman douchebags who will take advantage of their desperate situation and happily separate fools from their money, leaving them with nothing but a reflective surface on their new, shiny scalps, as well as an empty wallet. Absolutely awful. These snake oils have been around for a while, and they have various names like Niacin, Viviscal, Nutrafol, Revivogen, HairGuard, the Helsinki formula, amongst many others. Even though they're all equally as ineffective, they assume that their consumers typically do not know any better, so often in their marketing they'll attach some flimsy, poorly conducted research that has the stamp of approval of some paid actor who wears a stethoscope and a medical jacket to appear in their ads to give the product some veneer of legitimacy, because what charlatans discovered a long time ago is you can make a more convincing argument to sell your product, whether it be for hair loss, weight loss, penis enlargement, or whatever, so long as it is backed by a figure with some semblance of authority, like a doctor, for instance. And that is what leads us to the product or line of products I'd like to talk about today, Adegen. So I was made aware of this product by one of my viewers, and even though I take a very conservative approach when it comes to hair loss treatments, such as sticking to the clinically proven treatments, I do welcome innovation in the industry, and occasionally we do see some things that fall outside of mainstream treatments that have promise, like Floridel. So I looked into this with an open mind, and I was hoping it was going to be something similar to Promox, which was a cool topical sold by a doctor that was a combination of minoxidil, topical finasteride, and progesterone, actually, which was an expensive treatment, but it was still an effective treatment that I used early in my days, and when I was still relying mostly on topical. Sadly, it's not around anymore, but it was pretty cool while it lasted. So I was thinking that this was going to be some cool new product, and I can reveal it to my reviewers and bring attention to it, much like I did with Floridel and Alpha-Trial. But sadly, I ended up being about as disappointed as I was when I saw the ending to Mass Effect 3. This product, Adegen, is a travesty to the hair loss community, and even by the standards of the hair loss industry, which, as you guys know, is one of the biggest scam industries to have ever existed. This product is one of the worst things I have ever seen, and this is coming from the perspective of someone who has reviewed products from HairGuard. Dare I say it, this Adegen product may even be worse than what HairGuard promotes. The first thing I noticed was the website itself. It looks like some shitty blog from the early 2000s rather than a professional website. So what we have here on the page is a list of products, some of which cost up to $500, and it looks like we've got a button in the left-hand corner that leads us to different sections of the website. So, okay, I clicked on the menu button, and the first option says, quote, start here. I don't like being told what to do, but fine. Let's go ahead and start here and see what this amateurish-looking website has to say about their product, Adegen. Quote, our goal is to not sell you a product or service that you do not need, unquote. It must be pretty difficult to stay in business then, since you're selling a product nobody needs. He then goes on to give the impression that he cares about good business ethics, which is about as believable as when a stripper says she likes your personality. What was interesting, though, is he has a link to an ebook called, quote, Secrets of Hair Loss, unquote, which is a pretty audacious title, since somehow this one individual with no medical or pharmaceutical background whatsoever thinks he found a solution to hair loss, which is better than what pharmaceutical companies have invested hundreds of millions of dollars of research into, hiring the brightest and most talented doctors, chemists, and pharmacists in the world who test their research on thousands of subjects. So let's go ahead and see this secret of hair loss this prodigy has blessed us with. So I clicked on the link and I got what looked like a pop-up spam ad that reminds you of those ads you see that give you viruses and malware, mostly on porno websites, but I went ahead and clicked on it anyways, hoping to see what wisdom this hair loss messiah could bestow upon me, and instead I was redirected to yet another pop-up ad that said I was 90% there. Well, 90% sounds pretty close, so let's not give up. So finally, I was brought to a screen where I was given the option to put in my name and email. Fine, whatever, let's just get this over with. So anyways, after dicking around with the registration and pop-up ads, I was finally given access to the ebook. Actually, just kidding. I was just brought to yet another secret screen that insinuated I was going to get some sort of super secret information about hair loss by joining a secret community, kind of like the hair loss Illuminati or Majestic 12. I felt like I was going to the dark web, so I nervously proceeded forward, and rather than finding an ebook, I found something more familiar: Facebook. It's just a goddamn Facebook group, and how convenient is that? What better place to put an ebook than a community where the author has full control over all comments and criticism and can ban and censor anyone who challenges his worldview? If he were so confident about this hair loss secret, then why wouldn't he just put it on his website? He is trying to sell a product after all, so why all the obfuscation? Just tell me why I should give a damn about this damn product already. Meanwhile, I checked the email and the ebook never came, so I guess this Facebook group is the ebook or something. So, not wanting to join a Facebook account, I decided to see if I could find another source of this apparent secret to hair loss this guy has discovered, a secret that is so shrouded in mystery not even Big Pharma could ever hope to uncover it. Well, fortunately, there does happen to be a, quote, education, unquote, page that spills the beans on this secret, so rather than inducting myself into the hair loss equivalent of the Skull and Bone Society, let's just read what he wrote on the education page. So good news, guys. I just read it and I uncovered the great secret to hair loss that John Goss, the owner of the company, has discovered where everyone else has failed. So what is this big secret to hair loss? Spoiler alert, it's blood flow. I'd suggest HairGuard sue Mr. Goss for intellectual property theft, but the truth is that the blood flow theory is nothing new. The idea of stopping hair loss by increasing blood supply to the scalp is an idea that dates back to the Paleolithic era of the hair loss dark ages. For example, here's an old advertisement from the 1920s which shows a vacuum pump which is marketed to stop hair loss because it promotes blood flow. It's kind of like a precursor to the blood flow band that HairGuard sells, even though both of them are equally as worthless. So before going further into the blood flow theory, let's look more at the education section and see what kind of evidence he presents to back up his theory. Well, his evidence is that problems with blood flow can cause heart attacks, so therefore problems with blood flow can also cause hair loss. The only articles he references are articles about heart disease, which literally have nothing at all to do with hair loss. He gives a quote about the incidence of heart disease in the United States, then says the statistic was published in the journal Circulation. Then, he makes the extraordinary leap of logic that since there is a heart journal named Circulation, it must be that circulation is the key to hair loss. I kid you not, you can see it here in black and white. He then says, quote, the actual cause of hair loss is blood flow restriction to the hair follicle caused by DHT attaching to the androgen receptor of the hair follicle, unquote. Well, he's not too far off here, but it's not as simple as just increasing blood flow to the scalp, or else everything that increases blood flow to the scalp would work, such as, cardiovascular training, for instance. And if he acknowledges that DHT is causing this, then why the hell not just lower DHT? Well, his reason for not lowering DHT is predictable, but I'll go ahead and quote him, quote, the idea is that if DHT is causing hair loss and you stop DHT, you will stop hair loss. In theory, it makes sense, but here's the problem. DHT, a form of testosterone, is a natural and healthy hormone that our body needs to function properly. That is why there are so many negative side effects with Propecia and other products focused on blocking DHT. Depression, extreme chronic fatigue, brain fog, slow healing were all side effects I experienced when taking Propecia, and a stronger relative dutasteride, both focused on lowering DHT in your body. The worst part was that finasteride didn't even stop my hair loss. To reduce DHT to a level low enough to actually have a significant effect against hair loss, it would have to be much higher than the dose of 1 milligram of finasteride to dutasteride, and the consequences and side effects would be horrible. Unquote. So what he's saying about DHT being a natural and healthy hormone that our body needs to function is just not backed by any credible scientific information whatsoever. DHT is in fact important during fetal and pubertal development, but post-adolescence, DHT does not have any benefits in men at all. All it does is cause acne, hair loss, and enlarged prostate. To compare it to testosterone is ludicrous, as testosterone is the main male hormone that is essential for male virility and physiology. DHT is safely suppressed by millions of men, as finasteride is the 82nd most prescribed medication in the entire world. If DHT were so important, then everybody who took finasteride would get side effects. Testosterone is the good, main male hormone. DHT is a trash beta hormone. You can't suppress testosterone without hurting your virility, but DHT can be easily suppressed as its levels are only 1/8 of testosterone in the human body, and it is only active on select tissues like the prostate, the skin, and scalp, where it wreaks havoc on your body. If you want more detail about why DHT is a trash hormone, check out my videos on the subject, which I'll link below. He then goes on to say that he personally experienced a whole slew of side effects on finasteride and on dutasteride, and that it didn't stop his hair loss. So, based on his personal observation, he thinks that finasteride is ineffective for everyone just because it didn't work for him, and this is assuming he's even telling the truth. But one claim I found curious was him saying that you need to take a much higher dose than the standard 1 milligram dose of finasteride to get an effect. Literally, all the data that exists on finasteride for hair loss is based on the 1 milligram daily standard dose. And in the clinical trials, it was shown that 88% of men with mild to moderate androgenetic alopecia had a response to finasteride, meaning they all either maintained or regrew some hair, and this is with just finasteride alone, not combined with minoxidil, which would be even more effective. So, what this guy was doing was just gaslighting about finasteride because he knows his laughable products and blood flow theory are not corroborated by any strong scientific research. So rather than prove to his consumers his product is successful, he needs to scare people away from what actually works so they'll consider what he's selling despite the lack of evidence and just buy it out of desperation. If he had evidence, then he would have quoted on the website. I mean, why wouldn't he? Even garbage products like Nutrafol have a science section, and even though it is not good science, at least there is something. This guy literally has nothing to back up the efficacy of his products. He just makes obscure, overly simplistic claims on the mechanism of hair loss without going into any detail as to why his products would be better than conventional treatments. So naturally, he is not a big fan of minoxidil either. He assumes minoxidil works for androgenetic alopecia because of its effects on blood flow, since it is a vasodilator in fact, although the true mechanism of the effect of minoxidil on hair growth is not known, but it probably isn't related to blood flow, otherwise all blood pressure medications would promote hair growth, as would any lifestyle activity that improves blood flow like losing weight or cardiovascular training. But he is such a big fan of the blood flow theory that he says he takes niacin, which causes vasodilation and a lot of flushing, and he also says he used to take oral minoxidil, but he then dropped it because his blood pressure was too low. So he takes niacin, and he apparently takes it because he likes the tingle that it gives him, and he claims that it is somehow more effective than minoxidil, but he cites absolutely no evidence whatsoever. So I guess whatever evidence he has behind that claims is hidden behind his secret ebook, which, I'm still waiting to be delivered to my email inbox, although I'm not very optimistic that it's going to be arriving anytime soon. But anyways, he then goes on to say that minoxidil won't work anyways because the real cause of the blood flow restriction is the DHT binding to the androgen receptor. So this is a misleading half-truth. Certainly, DHT does bind to the androgen receptors, and it is the main culprit of hair loss, but the reason why DHT causes hair loss isn't due to changes in blood flow to the scalp. Keep in mind, your hair follicles are individual organs with their own blood supply being fed to them by capillaries. DHT causes a decrease in IGF-1 levels, and IGF-1 is a hormone that causes the growth of capillaries that feed blood directly to the hair follicles. Without IGF-1, the capillaries are replaced by scar tissue, and no amount of increasing scalp blood flow will deliver any oxygen to the follicles anymore. So it sounds like he at least admits that DHT is the problem, but he doesn't want to use any approved drugs to suppress it or block it because he is afraid you'll actually use something that works and not waste money on the crap he's peddling on his website. So his education page is basically just a mix of hair loss, conspiracy theories, and telling people shit they already know, like DHT causes hair loss. I mean, wow, stop the presses. I don't think anybody already knew that one. So anyways, if DHT causes hair loss, but we shouldn't use finasteride because this guy tells us not to, what does he propose with his Adegen product? Well, he describes Adegen as a, quote, natural and completely safe fatty acid that binds to the hair follicle and blocks DHT from attaching. Adegen ARB is actually treating, stopping, and blocking the cause of hair loss at the site of hair loss, the hair follicle, unquote. And he then goes on to cite several peer-reviewed, randomized controlled scientific studies involving several groups of patients on existing hair loss treatments like finasteride, as well as minoxidil, and then he compares them to his Adegen product and also to a control group in order to get the best possible outcome data without any risk of bias or results being due to chance. So what were the results of these comprehensive scientific studies? Well, there were no results because they never happened. He has no scientific evidence, and since this is a proprietary blend we just have to take his word for it, and that's asking a lot for someone who apparently has no qualifications or experience in practicing medicine or even developing pharmaceuticals, although he does say he consulted with numerous doctors and chemists, maybe he consulted with the Dalai Lama as well as the Science Patrol from Ultraman when he was creating his alchemical masterpiece. I mean, who knows? So since he didn't bother to cite any scientific evidence for his products or go over why anything in them may actually work, let me do the job for him and look into what he barfed up in this all-natural goo he made. Well, there are various formulations of this Adegen thing on his website, and they are categorized as either a shampoo or a topical solution, and of course, he advised you to use both of them because that means more money for him, and he also sells a Derma Roller called 10 Times Roller. Now, Derma Rolling as a hair loss treatment is not uncommon. A lot of people sell them and they claim they fight hair loss, but what I found interesting about the claims he made about his particular Derma Roller is that it increases the absorption of his products by 1,500% when compared to just using a topical alone. So I anxiously scrolled further down to look for the study in question, only to find a blank space. I guess maybe it's hidden somewhere in that secret Facebook page, or maybe he has an underground dungeon where he keeps his research, I don't know. Now, I know people here will disagree, including people in good faith, but I don't think Derma Rolling is very effective. I've used it in the past and I did not find it effective, and I am not convinced by the studies behind it either. In fact, I even made a video about it a while ago, which I'll go ahead and link below, but even if you disagree with me and you're convinced that Derma Rolling is an effective treatment, this is probably one of the least cost-effective ways to do it. He's selling his Derma Roller for $70. He doesn't even disclose the length of the needle, but if you go to Amazon.com, you can find Derma Rollers on sale for as cheap as $10, and even the fancier ones rarely exceed $20. So I don't see what makes his Derma Roller so exceptional as to justify charging as much as 7 times more than an inexpensive Derma Roller, which will still do the exact same thing. So the Derma Roller isn't specific to Adegen, it's just an overpriced version of something you can already buy. But what about the topical solution? Well, it turns out that despite Mr. Goss bashing minoxidil in his science section, his Adegen ARB topical solution is in fact just an overpriced version of 5% minoxidil with a bunch of other useless crap thrown in, including his proprietary blend of a linoleic oleic fatty acid complex, which is the big secret sauce that apparently distinguishes his product from everything else. But I gotta hand it to him, he was clever to put minoxidil in his product, so now if someone uses it and does get results, they may be convinced enough to think that it was this magic Adegen formula that caused people to get results and not just the 5% minoxidil, of which you can just buy the generic version for a fraction of the price. And I'm not kidding, I really mean a fraction of the price. If you go to Amazon.com, you can buy 6 2-ounce bottles of generic 5% Kirkland minoxidil, which is a 6-month supply, for about $34, and I sometimes see it on sale for even cheaper. But if you want to buy his topical Adegen product, which is also 5% minoxidil, it is going to cost you $70. $70 for 6 bottles? Nope. $70 for just 1 2-ounce bottle. Only 1/6 of what you can get with the Kirkland minoxidil. He will give you a deal if you buy 6 bottles, but it's still going to cost you $300, which is 9 times the prices of generic minoxidil. So since this guy is basically selling just 5% minoxidil for about as much money as that would cost to lease a Porsche 911, what else could he have possibly added to this to justify the extra price? So the vehicle of the product is the same as in generic minoxidil. It is a mix of water, propylene glycol, and ethanol. So even though these are inactive ingredients, I can tell you that since this is the same carrier as generic minoxidil, it is not going to dry any faster or have a superior cosmetic effect. It's still going to be just as greasy as generic minoxidil, which makes Adegen even worse than some other deluxe minoxidil products like Lipogain that offer a propylene glycol-free version of their product, even though I'd argue that's still a ripoff as well, but at least it will dry a little bit faster and maybe have a slightly better cosmetic effect. So at least in that sense, you feel like maybe you're getting more of your money's worth, even though it's still a ripoff. But what about the active ingredients? Well, let's go ahead and start with his secret sauce, this proprietary fatty acid blend of linoleic and oleic fatty acid. So why would he include these at all? Well, such fatty acids have been researched as 5A reductase inhibitors, including linoleic and oleic fatty acid. In a study on mice, it was shown that these two fatty acids promote hair regrowth in shaved mice due to them being 5A reductase blockers. So these substances may theoretically have some weak 5A reductase activity, but we have no idea if they are effective in humans, and even if they are effective, we don't know how effective they are compared to conventional therapy, and we don't know anything about actual dosage. For all we know, this bottle only has a nanoliter of fatty acid. If you really want to try linoleic or oleic fatty acid, why not just go to the grocery store and buy some sunflower oil and rub it on your scalp? Sunflower is rich in both oleic and linoleic acid, so how is this even a proprietary blend, I wonder, if it's found in nature? I mean, if you really believe putting sunflower oil is going to regrow your hair, you might as well just buy some sunflower oil and you can either rub it into your scalp yourself, or you can even mix a few drops with your minoxidil or whatever topical you're using. I mean, hell, you don't even need to go to the grocery store. You can buy a 128 fluid ounce of this guy's proprietary blend for just $29 in the form of sunflower oil. So can someone explain to me again how this 2-ounce bottle of Adegen possibly costs $70? I mean, it makes no sense to me. But besides the active ingredients, which is just a cheap vegetable oil, what else does this failed Witcher potion have in it that makes it so damn special? Well, it also has some B vitamins in it, particularly it has biotin and niacin. So biotin deficiencies have been linked to hair loss, but biotin deficiencies are not common outside of the developed world, as it is easily found in many foods, both naturally or fortified, and can be supplemented with cheap over-the-counter supplements like multivitamins. Some people can get biotin deficiencies from things like crash dieting, which can not only cause hair loss from a biotin deficiency, but can also cause telogen effluvium, which is stress or trauma-induced hair loss. Also, some people who eat a very large number of eggs, usually a dozen or so more eggs daily, can also develop a biotin deficiency, since egg whites contain avidin, which is an anti-nutrient which binds with biotin and prevents it from being absorbed into the gut, although not many people eat more than a dozen eggs per day, although it is becoming common in some fitness circles, so it's not completely unheard of. But the thing is, though, is that we're talking about dietary biotin, not biotin that is applied to the scalp. So even if you do have hair loss as a cause of a biotin deficiency, which isn't common at all and is reversible with sufficient nutrition, using this product will not necessarily treat it. A large review of biotin for hair loss published in 2017 showed that unless you have a biotin deficiency, use of oral biotin supplementation lacks any evidence of being effective in regrowing hair. Now, regarding topical biotin, a 2019 review study again found no evidence of biotin being useful for hair growth unless there was already a biotin deficiency. So foods like mushrooms, beans, seeds, nuts, avocados, sweet potatoes, and broccoli are all rich in biotin, and if for some reason you feel you can't easily get these foods in your diet, you can just go ahead and take a biotin supplement, which is dirt cheap, as is a multivitamin, and would probably have more health benefits than applying it topically anyways, which has never been shown to be effective as biotin absorbs in the gut. So, who knows what putting on the skin's going to do. So the other B vitamin mentioned in the ingredients is niacin, and this goes back to the whole blood flow theory. Some people will use large amounts of niacin in order to cause a flush, which is when you have increased vasodilation and you feel like warm and you get all pinkish, and thus theoretically this causes an increase in blood flow to the scalp. But again, this does not work because, like we discussed earlier, it doesn't matter how good your blood flow is to the scalp. If DHT is stopping the development of new blood vessels, none of that new blood will reach your hair follicles and they will all die all the same. Take a scalpel to any bald man's scalp and I guarantee you it will bleed. The notion that bald men somehow have reduced blood flow to the scalp is ridiculous, especially since there are elite athletes out there who are bald and no doubt have exceptional cardiovascular health. Also, as noted in the study I just quoted, niacin deficiency has never been associated with hair loss, so it doesn't make much sense to apply it topically if even a lack of it doesn't have a negative effect on the hair. In that regard, it is even more useless than biotin, since at least biotin can treat hair loss in some extreme circumstances. So anyways, the next active ingredient which may spur some interest is retinol. Retinol is basically just a form of vitamin A, and its effect on the hair is a bit of a mixed bag. Both retinol as well as tretinoin, which is a drug synthesized from vitamin vitamin A have been shown to potentially enhance the effects of minoxidil. In the case of tretinoin, it's been found that tretinoin upregulates the sulfotransferase enzyme, which some people lack, and this is the enzyme that is necessary to convert minoxidil into its active form, minoxidil sulfate. The vitamin A in Adegen, though, is retinol, which is found in foods, and it has also been shown to maybe enhance the efficacy of minoxidil, at least as we've seen in human hair follicle cell cultures. Unfortunately, vitamin A is also a toxin, and in particular, too much vitamin A has even been shown to cause hair loss, so we don't know how much vitamin A is in this product, and whether or not it is too much or too little. And lacking this information, I think we really should err on the side of caution, and it's probably safer to take your minoxidil straight up and not with a chaser of vitamin A. So even though the data on retinol and sulfotransferase upregulation is interesting, keep in mind, this was just an in vitro study performed in a cell culture in a petri dish. The results have never been replicated in humans. So the actual good data on vitamin A is on tretinoin and not retinol, which is what is found in Adegen, and the tretinoin data is based on human subjects versus the retinol data, which is only based on cell cultures. However, tretinoin is a prescription drug, so it can't be purchased over the counter, and therefore we are left with just retinol and this stuff, and we don't know even how much is in there. For all we know, there is just a negligible amount in there. I mean, after all, there is only so much crap you can fit into one small 2 fluid ounce bottle. So anyways, the last two ingredients in this product are adenosine and caffeine. So both of these ingredients are in fact backed by scientific research, but they've never been tested together until recently. In fact, there is a study from 2019, and it is a randomized control trial involving just 8 subjects. And the way they did the study is that they applied half of the scalp in an ethanol-based solution containing both 0.75% adenosine and a 1.5% caffeine solution. The other half of the scalp was just given a placebo tonic. So this was the way the researchers could measure up the growth on each individual subject compared to placebo without actually needing a separate control group. So that was pretty creative, I thought. Anyways, the study was conducted over a course of 8 weeks, and to measure the progress, the researchers used an ultra-close image of the hairs on the scalp done every week and counted the total number of hairs and calculated the hair density compared to the other side of the scalp that was just given the placebo solution. After 6 weeks, it was shown that hair density increased from 1.21 to 1.7 hairs per square millimeter, which sounds substantial, but again, the big problem with this study is a very, very small sample size, only 8 subjects, keep in mind, and there are no follow-up studies. Also, even if we do accept this study as being significant, keep in mind that this solution contained a very specific amount of caffeine and adenosine, and we have no idea how much of these ingredients are in Adegen. Keep in mind, we're talking about a small 2-ounce bottle here that has every ingredient this guy could possibly Google as maybe being beneficial for hair loss, so who knows if this product has sufficient quantities of this active ingredient to reflect the results found in the study. The researchers in the study were using their own specific mixture of adenosine and caffeine. They were not using Adegen, which for as far as we know, could only contain a homeopathic dose of the drug, since he doesn't reveal the quantity of the active ingredient in his product. Additionally, keep in mind, one bottle of this stuff is $70. If you really wanted to try a topical caffeine and adenosine formula, you could just buy a bottle of liquid caffeine and adenosine and combine them together, and you'd still save money. For example, you can buy a 200 milliliter bottle of liquid Alpacin, which is not the Alpacin shampoo, but rather it's a leave-in formula of caffeine, and 200 milliliters is about 7 fluid ounces, so you can get over 3 times the amount of liquid than you get from a 2-ounce bottle of Adegen. And if you want to combine adenosine with that, you can buy Preventix Adenoblast, which is only $24, but unlike Adegen, you actually do get the concentration that was studied, and it's namely a 0.75% formula, so at least with this product, you're getting the same percentage of adenosine that was used in the research about it, and it is nearly $50 cheaper than Adegen. Of course, I don't think you really need to bother with any of this. I think most people would be served perfectly fine with just regular, plain old generic minoxidil. But the underlying point of all this is that even if you are convinced by the research behind caffeine and adenosine, Adegen is still a bad choice since it is exorbitantly overpriced, and the company doesn't even disclose the quantities of the active ingredients, so there's no way to know if what is being sold to us will match up with the existing research. This guy doesn't even show the active ingredients on his website. In fact, I had to go to a different website to find them. So So if there is anything that for sure works in his product, then it's probably just the minoxidil. And that is the only reason why maybe some people get results and end up trusting this product, because the results they were getting were from minoxidil alone, which of course you can get for much cheaper than this. It's also ludicrous that on his Wayne website, he doesn't even mention that his product contains minoxidil. Instead, he touts his magical fatty acid combo, which again, you can probably get the same effect of by just putting salad dressing on your head. So for all the hype this Adegen product has generated, all it really is just fancy, overpriced minoxidil. He claims to have discovered some sort of secret-defining hair loss, but there is nothing in his product that is unique or can't be found for cheaper in other products. So I don't know what the big fuss about this product is. I mean, there have been plenty of fancy, overpriced minoxidil products in the past that have come and gone, and many that are still around today, such as Lipogain, as well as the Spectral products from DS Laboratories, and most of them have the same ingredients too as Adegen. I guess what makes Adegen worse than these products, though, is that this guy who runs it really goes out of his way to fearmonger about traditional treatments. He even fearmongers about minoxidil, which is especially hypocritical since minoxidil is actually in one of his products. And also, he fails to provide any research supporting his products. He's just basing everything on his personal experiences, as well as comparing hair loss to heart disease, which he just randomly pulled out of his ass. He also sells a shampoo too, again for $70 US, but there is nothing special about it, and there is nothing in it that can't be found in other shampoos for much cheaper, so I don't think it's really worth mention other than telling you guys you obviously shouldn't buy it. Literally everything you see on his website, from the Derma Roller to the topical to the shampoo, is just a rebranded, overpriced ripoff of another product. So this guy is clearly just a grifter who's trying to victimize people who are new to the hair loss fight and don't know any better. So please, folks, don't give this asshole any of your money and just stick with the clinically proven treatments that we know work, like finasteride and minoxidil. This guy does not care about you. He probably doesn't even have the male pattern baldness gene, but he does know men who are losing their hair and don't know any better may be desperate enough to give him their money, and he preys on people like that selling his bullshit products, and for that makes him a completely dickless snake oil salesman as well as a grade A douchebag. So with that, I think I'm going to go ahead and sign out, so I'll go ahead and see you guys next time. Take care.